Well, good afternoon, and thank you so much for allowing me to share this information with you today. This is the next in our series, our Lunch and Learn series, if you will. And what I'm doing right now is we are going to be focusing on shoulder pain, as the slide here tells us. So I want to thank you first and welcome you. And I'm very pleased that you made it today, especially given the current circumstance of things that are going on around us. And if anyone that's joined us today doesn't know who I am, my name is Dr. Robert Bartosh of Proactive Wellness and Injury Center. And our passion, our goal is to help anybody and everybody who comes to us, help them to achieve the best performance of their life. So again, thank you so much for being here today. So as we get into this, what we want to do is we're talking about the shoulder problems. I want to talk to you first about anatomy. Now, the shoulder, not unlike the rest of the body, has been fearfully and wonderfully made. And this area of the body is it's very intricate, if you will. It has the capacity of almost moving almost 360 degrees in motion. And the shoulder really by far is actually the most mobile joint in the human body. Now the bones that make up the shoulder include what's called the clavicle or your collarbone. And then there's the shoulder blade. That's in the back there. That's known as the scapula. And then there's also the upper arm bone. That's the humerus. You know, when you hit your elbow, and you feel that burn going down into the hands, they tell you that you hit your funny bone. Well, that's basically you're hitting the nerves that are coming out of the bottom or the distal end of the humerus. They're by the funny bone, the humerus. And now we look at the joints. The shoulder joint itself is known as the glenohumeral joint, and it's basically a ball and socket type joint, and it facilitates or it enables the arm to move forward and in circular motions, and then backward and forward as well, all coming from the shoulder. Then in addition to that, there's what's called the sternoclavicular joint, and that's where that clavicle meets the sternum. That's your breastbone. That's the sternoclavicular joint. And then there's the acromioclavicular joint. That's the other end of the clavicle. And that's where it meets the acromion. That's the top of the shoulder blade that's coming up over, and the end of the collarbone or the clavicle meet there, and that's called the acromioclavicular joint. Now, the shoulder is also made up, of course, in the soft tissue area. It's made up of ligaments, and the ligaments are like white, shiny, flexible bands, and they're real thick. It's like almost like chicken gristle. They're the fibrous tissue that holds the joints together. And what they do is the ligaments now, in particular, they connect bone to bone. They join the bones together. Then other soft tissue would be the tendons, and those are really strong cords. And that's what connects the muscles to the bones. And with those together, those combined help the shoulder move in all of the directions that I talked about just a few moments ago. So let's talk then about the movement of the shoulder. Because it's a ball and socket joint, basically, it has many different movements. And as I alluded to, you can extend it, you can stick it out, you can flex it. That means you can bring it toward your body. You can abduct it. That means you can take it away from your body. You can adduct it as well, bringing it close into the body. You can rotate the arm or the shoulder internally, bringing it, it's like spilling a cup or pouring out a cup. You can externally rotate it. It's like when you're going to, I don't know if many of you remember a time when there was hitchhiking where the person would extend their thumb out in order to get a ride on the highway. That's the external rotation. Or a pitcher that's pulling his arm back in order to throw the ball. Those are some of the movements that are able to do, or you're able to do, because of the construction of the shoulder. But I want you to know, with all of these movements, even a minor injury can limit the range of motion. Even a minor injury, something that we might dismiss as no big deal. And these minor injuries, if they're allowed to go unattended, they can become very frustrating and very, very painful indeed. Now, with that, having said that, there's a wonderful segue here to talk about some of the more common conditions that affect the shoulder. There are many, many ways the shoulder can be injured, and the most common shoulder problems fall into basically four major categories. You can have tendinous inflammation. They used to call it bursitis. Now it's more commonly known as rotator cuff injury. But you can have the tendinous inflammation, which was the bursitis, and the tendinitis or a tendinal tear. So you can inflame the tendons or you can tear the tendons as well. Then there's the instability. That's a category too of shoulder instability. Then there are conditions known as arthritis that can affect it. And of course, the acute trauma to it where you fracture or you break the bone, one of the bones that make up the shoulder joint itself. So what we want to do now is to go ahead and discuss each of those and make you aware of what they are. And the first of which, not necessarily in the order of complication or severity, but this is how I put the slides up. We will talk about bursitis. Now, there's a small fluid-filled sacs, and those are called bursae. And they act as cushions between the bones and the soft tissues, and it helps to reduce the friction between the muscles that are moving and the bones that are in that area as well. Those are bursal sacs, and they're found in the joints throughout the body, especially in these very mobile joints. Now, overuse of the shoulder can cause it to become inflamed. That's a friction type of thing, and it can cause, or result, I should say, in the swelling of the bursa between the shoulder and other parts or bones that are making it up. And especially we see this in, remember I told you the bursitis, now it's known as the rotator cuff or rotator cuff injury, and that results in a part of the shoulder blade in a condition that's now known as subacromial bursitis. So that just simply means it's below the acromion or the shoulder blade as it comes up over the shoulder, and it results in that inflammation of that sac there. Now, while bursitis, with the bursitis, many daily activities, such as even, trying to comb your hair or raise your arm up above your head or even getting dressed, it can become or present difficulties in doing so, okay? So it's not something that we want to dismiss or take lightly. Another one now is the inflammation of the tendons. That's the tendinitis here. And remember, those are the cords that connect, they attach the muscles to the bones. Now, inflammation in the tendons, it can result in one of two types of tendinitis or inflammation of it. There's acute tendinitis that can occur, we'll say, due to an excessive ball throwing. We have these young athletes that come to us, and unfortunately, some of these coaches tend to overwork these young people, and they excessively throw the ball over and over and over again. And because of that, with that overhead activities, it can result in the tendinitis affecting the shoulder joint, more commonly in the elbow, but it can happen in the shoulder as well. And there's other overhead activities during work or during sports that can result in that acute injury or inflammation of the tendon. Then the other type is the chronic tendinitis, and that's attributed to like repetitive wear and tear, and it degenerates the tissues in there, one of which could be a condition known as arthritis, or it could be due to overuse. Again, I go back to the picture, throwing over and over and over again, or doing work that's repetitive, overhead activities or whatever, which can wear out the tendon, or literally it can tear those tendons. And that would be called or classified as a chronic tendinitis. Now, the most commonly effective tendons in the shoulder are the four as I mentioned earlier, these are made up of tendons. That's the rotator cuff. And the rotator cuff tendons and one of the bicep tendons as well. The bicep is that muscle that all the bodybuilders show off. You know, the guys are squeezing their arms and flexing it. They're showing that muscle there. Well, those are very, very commonly affected. The tendons, again, are the four rotator cuff tendons, and then the fifth one being the bicipital or the biceps tendon. And the rotator cuff, it helps to provide the shoulder with the motion and the stability, and it keeps the arm, if you will, in its proper position. Those are the rotator cuff ones, okay? So now that we talked about the inflammation, and I did speak about the tendinous tears, we're going to look at that a little more closely here. So you have the tendinous tears that occur too. The long-term overuse, again, over and over and over, and the wear and tear, it can result in a sudden injury or aging, can cause the splitting or the tearing of the tendons. So again, the tears of the tendons can be a result of a long-term overuse of the wear and tear of the tendon. It could be due to a sudden injury where, let's see, somebody has their arm pulled back very, very quickly due to a fall, or there is a very heavy load that they were unprepared to receive, and all of a sudden it's dumped in their arms, if you will. That sudden injury can rupture or tear the tendons, or it can be due to aging. You know, it's getting older and older and older. Not necessarily the person getting older, but the inflammation of the tissue can be old. It can be an old injury, and they just neglect to take care of it. And what happens is, after the initial inflammation kind of settles down, that tissue, because it's being worn out because of overuse, it starts to split, just like a fabric, if you will, and then it starts to tear and come apart until it can rupture, and it can tear from border to border. Now, the tears, as I said, may be partial, but in severe cases, the tears are completely from border to border, and they separate the tendon from the attachment of the bone. And what can happen there is then you'll see muscles that will roll up. We've seen this bicep tendon tear, where the bicep, just like an old blind, a window blind, I don't know, or a tape measure, it rolls up into a ball or something. I don't know what example to give you quickly here, but when the tendon tears, that muscle is no longer attached to the bone, and it can ball up in a ball inside the upper arm, or if it's happening in the lower leg, one of the gastrocs or the soleus or whatever muscle it might be affected, will roll up in a ball there, and you'll see that there when it comes off the bone. And then there's the rotator cuff and the biceps. Those are the most common, though. The rotator cuff tears, those tendons, and the biceps tendon. Those are the most common ones, and it makes sense because of the use that we have, you know, focusing the use on the arms and whatnot. So the potential them of being injured is going to be much higher, and because of the load or the weight bearing that they are associated with as well, okay? Then another type of category or injury is the impingement. The shoulder impingement occurs when the top of the shoulder blade, it's coming up over the top there, that's the acromion. It puts pressure on the underlying soft tissue when the arm is lifted away from the body. So, you know, when a person is raising up their arm, to answer a question or to push something back up on a shelf, they might experience this sudden pain that occurs, and it stops them from going any higher. And as the arm is lifted, that acromion puts pressure there on that bursa, that little sac underneath it, and or the nerves coming through there. And because of that, And if they have a job where they're having to do this over and over again, why that repeated activity, pushing things up overhead, that can lead to the bursitis, again, the inflammation of the bursal sac, or the tendinitis, the inflammation of the tendons, and that really can wreak some havoc and cause some pain there. And the person then, in order to protect themselves, will not push their arm up any higher than a certain point, because they know if they go any further, they're going to experience pain. So it limits that individual's range of motion. Then there's another one. It's called instability. Now, the shoulder instability or dislocations occur when the arm bone, that's usually the humerus, is forced out of the shoulder socket. Now, this can happen as a result of overuse injury or an injury in and of itself. A partial shoulder dislocation, that's called a subluxation. That's when the shoulder's not, when the bone in the shoulder joint isn't pushed all the way out, but it's like, we'll say halfway out. That's a subluxation. And that results in the ball or the upper arm coming just partially out of the socket. A complete dislocation means that that ball or the top of that bone comes all the way out of the socket, and that you'll see a person's arm, it just is literally hanging down to their side, and they have an inability to move it at all. Now, a partial shoulder dislocation, that subluxation, that results there, as I said, it can happen like in football, one of the defensemen or a tackle or something, when the arm gets pushed just a little bit out of the socket, and or it can result in a total dislocation where that arm gets pushed all the way out. We usually see that in collision sports. We can see it in accidents where a person perhaps falls down a stairs, or is even heavy weightlifting. We've had individuals that do heavy bench presses, and because of them doing it over and over and over again, they're creating, again, an acute injury that they kind of dismiss, and they continue to do the heavy lifting, especially with straight bars, and then they create a chronic injury in the pectoralis muscles that are attaching up into the shoulder, and then those weaken and they become frayed, or the tendon will totally over time tear, and then boom, that when they're lifting this heavy load, it causes the one side to just give in, and then that shoulder, the weights will just drop on that side, pulling that bone out of place, and they can have a subluxation or a total dislocation because of the loose or the torn ligaments or the tendons and or the muscles that are around that joint. So recurring dislocations, that can happen too, and they may be partial or even complete. They cause pain and unsteadiness when they raise their arm or move it away from their body. And some people, they, even with a partial dislocation or a total dislocation, you've seen it perhaps in some of the movies where they dislocate their shoulder and then somebody else will come up and pull it into place or jam it into place, or you'll see the individual themselves slamming their shoulder into a wall or onto a car hood or whatever it might be. And you know that it can be corrected, but it's a poor quality correction, if you will. And in the movie or in the sports, they just continue to go on their merry way after they suck it up and whatnot. And you know that gives a false perception to the viewers, thinking that everything that is hunky-dory and it's been corrected properly, when in fact it's not. And because of that type of damage, they've already set in play where they may experience that type of a problem, where the individual can experience that on a recurring basis, and then he or she just simply, you know, does the same thing over again, where they slam their arm into the wall or their shoulder into a wall thinking that they're correcting it, when all the while it's getting worse and worse and worse, and they're causing some substantial damage that could result in the need for surgical repair where they lose the mobility of that shoulder for the rest of their life. But anyway, those are some of the mechanisms, and unfortunately, we see that happening in the world of sports, especially, where they dismiss these types of injuries. As I've said, the body is indeed fearfully and wonderfully made, but with that with that statement being made, because it is so intricate, it is such a marvel, it does deserve the best care given to it. So I guess we need to move on here. We'll go to the next one here, the arthritis. Now, any joint in the body can be impacted by arthritis, and arthritis simply means an inflammation of a joint, but it can also mean a degeneration of a joint as well. And there's different types of arthritic conditions that can affect the joints. Now, the most common type of arthritis in the shoulder is called osteoarthritis. It's also known as the wear and tear type of arthritis. The person can experience like swelling in the joint, pain in the joint, stiffness of the joint, warmth in the joint, and unfortunately, most of the time, it's something that's dismissed by the individual because, it'll go away in time and it will abate. It will reduce over time. There's no doubt about it. Or the person may experience these things, and while they're engaged into an activity, it kind of flares up. So they back off and discontinue that activity and move on to something else, and it will indeed get a little better as far as the pain is concerned. However, the condition doesn't go away, and as they continue to do this, that condition just gets worse and worse and worse, because the osteoarthritis here, it develops very slowly, and it's usually what I've seen in my practice, frankly, is it's related to sports or even work injuries. And guys are notorious for ignoring things or dismissing things. And as we do so over time, it leads to chronic wear and tear of the tissues. And when those tissues wear out or break down, it can also cause the bones themselves to start to wear or even change in their form, their structure. So that's something that we don't want to ignore, but we want to get it taken care of properly. And there's other types of arthritis that can be related to rotator cuff tears. It could be due to an infection that comes about, typically a staph or a strep infection in the bone or in the joint. So as a result of those types of things, there's that joint pain, and people, because of the pain, they avoid the shoulder movements, which sometimes leads then to a tightening or a stiffening of those soft tissues around the joints, and that results or can result in a severe restriction of the arm, in this particular case of the shoulder joints. See? And that's, boy, if that's going on, these are alarms, these are warning signals, these are the flashing red lights that are going off, and it's not something that can be taken care of by popping some kind of over-the-counter pain medication. This is something that really needs to be taken care of by a learned practitioner. Now, another thing is the fracture. The shoulder fractures or the broken bones, they most commonly involve the clavicle or the collarbone. And then the second bone is the humerus, the bone of the upper arm. And then thirdly, the scapula, like the shoulder blade. Somebody falls backwards off of a roof when they're tiling it and they slam into the cement or they land on the asphalt. That can break the shoulder blade. That can also break the upper arm there. Or people, I know that we've had some people that work with machines where they're drilling and all of a sudden the large drill will lock up, but the drill itself will continue to turn. And as it does, the individual's hand may become one with that piece of equipment. And as it turns, it'll twist that bone in the upper arm and crack it, or a piece of machinery can hit it, and it goes on and on and on. But again, as far as the incidence, the frequency, primarily, it's going to be a collarbone. We'll see that in football. We'll see that in other collision sports where they break the collarbone, the clavicle, and then also the breakage in number of frequency. It would be the humerus or the upper arm bone, and then the scapula would be the last. And as you can imagine, the fractures, they do cause, and they cause some severe pain. They cause some immediate swelling and also bruising, especially around that shoulder. Now, the older patients, they can experience shoulder fractures as a result from fall in their homes. You know, they trip over carpeting or something on the rug, and then they fall forward. They can break, you know, that upper arm, the clavicle, or the shoulder blade very easily, especially if the person is osteoporotic. That can happen as well, where the bones are thinning out. And there are additional causes of the shoulder fractures, like high energy injuries that you have in a motor vehicle accident, or the velocity injuries where the person is, you know, falling, as I said, off of a roof, or an elderly person falling down the flight of stairs. All of those, they would be velocity injuries. Those can happen as well. So now that we've talked about those, let's talk about how we keep the shoulder healthy. You know, like any injury, prevention is the key. That's why we are called proactive wellness. We don't want to react, we want to be proactive. And the best thing to do is to keep yourself healthy. So there's going to be several steps you can take to ensure good shoulder health. And, you know, as you are taking steps to promote the shoulder being healthy, that's going to benefit the rest of the body as well. So the first thing you want to do is to start to listen to your body. I know that really sounds simple and overly simplistic indeed, but too often our nature is to ignore the pain. And what that does, that results or opens the door to causing further damage. And when you have further damage, that also equals a longer period of time required to heal. So I want you to understand that the sooner you address a problem, the easier it is to resolve it, because the amount of damage is going to be minimal, and the healing time is going to be shortened immensely too, because again, there's little damage to deal with, so it doesn't require a long time. However, you know, when we have an injury, we dismiss it. We don't listen to what the body's telling us. We ignore it. We pacify it with over-the-counter medications or whatever it might be. And that results in further damage. And the longer the injury has been going on, the more damage that has been sustained, the more time is going to be necessary, and the more complex it's going to be to heal up that area. So if you're experiencing shoulder soreness or pain following an activity, my advice to you humbly is to not ignore it. There's really no need to tough it out. You want to just take a break for a few days, allow your body to go ahead and cool down, and then proceed very cautiously and into that activity once again a few days later. Now, if the pain is present once again, and if it starts to increase in the activity, then cease and desist and contact your doctor, whoever he or she may be. Until you see your doctor, or until you can get in to see your doctor, my advice is to go ahead and to put ice over that area. Now, please understand, I am not diagnosing, nor am I treating a condition, nor am I advocating a cure. I'm just saying that these are some good common sense actions you can take before you get into your practitioner. Now, another way to prevent the injury is to frankly stay active. You want to keep your body in good physical shape with regular exercise and of course a healthy diet, eating really good foods. Because not only is the physical activity necessary, but exercising the right way, form is of paramount importance, especially when you're lifting weights. I'm sure that if you've gone to a gym, you've seen all kinds of grunting and groanings going on, and people are screaming out loud in order to move a weight from one point to another. And a lot of what's being done is really not good form. And what's happening is they are, in essence, damaging themselves in their pursuit of trying to build their body up. They're tearing it down and damaging it. And instead of getting a healthier body, they're getting a weaker body. So you want, the form is very, very important. And that's very crucial to preventing any injuries from occurring. Also, if you are working out with weights in particular, or your body weight, whatever it might be, you always want to warm up before you work out. You want to start out slowly if you haven't done a sport or an activity or the exercise in a while, and a while means in a day. If you haven't done it, or if you've been sitting around and now this is your time to go and work out, you definitely want to warm up the body. You want to learn how to bring the blood from your diaphragmatic area. That means from the middle of your body, you want to bring it out into the muscles in your body, because now you're going to be working out, you're going to be using those muscles there. So that's what you're wanting to do. You're wanting to bring that blood and oxygen into those muscles so that you can go ahead. They become supple, they become ready for the work or the demand that you're going to put on them, right? Now, and if you spend a lot of time like doing overhead motions, or you have a job that requires overhead work, you might consider, if you're doing workouts, to do cross training. Cross training can be a great way to avoid an injury while you're maintaining your own physical health, and it's preparing you for the job at hand. You've got to understand that just because you are an athlete at work doing the physical work that you do, in the same respect that any football player, any basketball player, any athlete is doing, how they condition themselves for the task at hand, in the same way you want to do that. And when you go to work, again, if your job requires you to do a lot of lifting at work or a lot of bending and twisting at work, it would benefit you if you would just do some warm-up exercises there, whatever they might be. Moving the arms, standing in place and marching for about a minute or so, or mimicking you're marching in place and moving your arms back and forth, doing those types of things. That can help you to warm up those muscles, and by doing so, that would eliminate the potential for you injuring yourself. If you do have a human resources person there, if you're doing working in a mill or a factory or whatnot, you want to talk to them and see if they have some advice for you on warm-ups, to do before work. And if not, you can contact us or have your human resources individual contact our office, and we'd be more than happy to help them out. So along with the warm-ups, you want to increase your strength. Lifting and exercising using the proper form, as I said a few moments ago, to strengthen your shoulder, it really can help in stabilizing that joint, and it's going to help to prevent like painful dislocation or partial dislocations of the shoulder. You can do some arm circles with weights, just like you see this young lady doing there. We're increasing the strength. You just stand with your feet like hip width apart, and you hold a light weight there in each hand, and you let your arms hang down loosely at your sides, and you lift them up and you make small circles, like in a clockwise or counterclockwise motion, both arms as they're in a horizontal position. And you briefly hold that, and then you can slowly lower your arms, even as you're still circular, doing that circular motion all the way down to your side. And you can repeat this exercise where you bring them up, and as that young lady in front of you is doing, and you're circling, and then bring them down to your side and lift them up again and start that circular motion. You can repeat that maybe 10 to 12 times. And do it that way. And you can either go forward in a clockwise fashion, do it one time, do it 10 times that way, and then do it 10 times where you're going in a counterclockwise fashion as well. Now, and then you can do a stabilizer exercise while you're holding that light weight. You stretch your arms out in front of you, and you make sure your hand is at the height of your shoulders, so they're straight out in front of you. Your arms are straight. You're holding that weight steadily for about 30 to 60 seconds. And then you just lower the arm, and then you can lift it up again and hold it out there for about 30 to 60 seconds. Do that maybe for 3 times. After you've done it out in front of you, take it out to your sides, and then just hold it up there and repeat that exercise about 3 times for 30 to 60 seconds. And that will help to stabilize or build those muscles up, those deltoids and those other muscles that are involved, that will help to solidify or stabilize those shoulder joints. Very easy to do, but very beneficial indeed. Now, also what you want to do is to avoid the on-the-job injuries. We want to avoid those indeed. So you can do so by actually just using good posture when you're sitting or when you're standing. And if you work at a desk, make sure that you get up from time to time and move away. Stand up every so often, walk down the hall and walk back, and then resume your position. But while you are sitting there, make sure that you are sitting up nice and straight. And you certainly want to avoid sitting there for long periods of time, because the longer you do that, the more the muscles fatigue, and the more they fatigue, the more apt they are to be injured. And then you look around and you see people that are doing that, and they're no longer sitting up straight, but now they're slouching in that area. So you don't want to do that. Now, also, when you're at work, when you're lifting in that, you want to do so safely by keeping your back straight, and you want to use the powerful legs of the muscle, or the powerful muscles of the legs. I said that backward there. I apologize. And also, when you are reaching for something, don't strain to do so. Like if you're reaching overhead, you don't want to stand up on your tiptoes and then, stretch out there to do that. Use a footstool. Make it easy on your body, regardless of how you are moving. The easier you can make the motion or the load on the body, the better off you're going to be. All right, those are just some common sense suggestions that we have for you. And also, when you're sleeping, you can change up your sleeping position. If you sleep on your side, be careful not to place all of your weight on your shoulder. You can use pillows, and the pillows will help to distribute your weight evenly to relieve some of the pressure on your neck and on your shoulder. And they don't come, unfortunately, it's not like a pair of shoes where the size, and you can figure out what size you need and then always go to that size for the next pair of shoes you're getting. You're going to have to experiment with this, because not all pillows are created equal. Not all pillows are going to work as well from one individual to another. And the heights of them, you just have to experiment, as I said, and find out what's going to work for you. If you are a side sleeper, you can use pillows in front of you in your chest area, so that you can kind of be at an angle where you're not truly perpendicular on your shoulder, but you're kind of leaning forward, which takes the pressure off the shoulder. Or you can sleep a little bit more in the backward position. You're on your shoulder, but you're leaning back, almost collapsing onto your back. And by doing that, you can put the pillows back there. And then also, it's important to build up that neck. You look at this young lady, and her she's not really the best actually, because I can tell her head's kind of dropped downward. You want that head position to be almost as if you were standing up. You want, and standing up straight, I should say. So you want to build that up, and as you build it up, you're actually taking the strain off of the neck area because of the weight of the head. And by doing so, you're also taking the strain off the shoulder. So having done that, then you might consider also alternating sides and even lying on your back from time to time. So when you awaken in the night, because I know even we are creatures of habit, and many people I found always fall asleep or start to fall asleep in the same position every night. So that's fine, well and good, as long as you're comfortable. And then you awaken, and then when you find yourself awakening in the night, just change your position a little bit there. Make sleeping on your back a little more comfortable. And if you do, you just place some pillows underneath your knees. And I promise you that's going to make sleeping on the back just a little bit more comfortable if you're not used to doing something like that. So sleep is very, very important. And you want to be as comfortable as you possibly can be, and you want to reduce the stress on the body as much as you possibly can. Okay. Now, the next one is the healing time. We want to talk about that. Um, People don't understand. You know, we live in a day and an age where we want everything done by yesterday, and unfortunately, it doesn't happen that way. The body is not instant in its repair. As I said earlier, the healing time many times is going to be proportionate to the amount of time that the person allowed that damage to continue without getting repaired or without getting going to the doctor to get it arrested. So it can take some time. Shoulder impingement, usually it takes anywhere from 3 to 6 months for it to heal up quickly. Now, don't forget, these arms hang down and there's gravity that's always continually pulling on the arms. You're using the arms. You never make it totally and wholly immobile. Those factors, and because of that, those factors impair the ability of the body to heal, and it also lengthens the time which is necessary for the body to heal. Many of us have a habit of not using our legs when we stand from a sitting position. You'll see many people that will push up with their arms, and that habit that we have will continually aggravate the shoulders as well. And we use our arms as battering rams to go through doors, or we pick up something without doing it slowly. We tend to grab it and then lift it very quickly. All of those types of activities can prevent you from healing up quickly. And you've got to understand that the shoulder is a very complex joint, as I alluded to earlier on in this. And because of the complexity, it requires some time in healing. And when following a shoulder injury, as I said before, the best thing to do when you know the shoulder is injured is to stop the activity you're doing, rest it, and put the ice on it, and get to a practitioner that is familiar with shoulder injuries and can help you out as far as getting you on the course of recovery. One of which would be perhaps physical therapy. It's often recommended for aiding shoulder injuries, and a physical therapist can work with you to tailor a rehab exercise routine to get your shoulder back to normal. But again, that depends upon the type of injury that you have or the individual has sustained. Now, when you go to a PT, the sessions can also include like various modalities they use. Those are therapies like stretching or massage they may use, or heat packs or cold packs in order to reduce or help to reduce the pain. That's an avenue that you might consider. But before you go directly to physical therapy, I think in most states you are required to go to a general practitioner. That would be a medical doctor or a doctor of chiropractic. And those doctors, he or she could then refer you, if they believe your condition warrants it, to a physical therapist. and the therapist would take over from there. Now, beyond the shoulder pain is the back pain. Now, doctors of chiropractic are known for treating issues of backs and spines, including the shoulders, extremities as well. Now, I must tell you that not all doctors of chiropractic are trained in extremity adjusting or in extremity care. So you'd want to search out those types of doctors with that additional training and then go to them, because it can be extremely beneficial as far as helping you to recover much more quickly than you would otherwise. But no matter what your specific shoulder issue is, a doctor of chiropractic is going to begin with a targeted diagnosis to determine the source where the injury is stemming from or where the pain is coming from, because many times you may think that the pain is totally and wholly situated in the shoulder, when indeed it may be coming from the upper back or the lower neck area. But based upon the examination, the evaluation that the DC would do, the doctor of chiropractic would do, he or she can go ahead and determine exactly the extent of the problem and all of the things that would need to be done in order to get that patient or to get you back to in tip-top order. But once the diagnosis of the precise physical cause is made, then that treatment can begin. You don't just want to use a shotgun approach, because when you affect one area of the body, and regardless of how large or how small that area may be, you are affecting the whole body in its entirety. So you want to get a really precise assessment. And many times relief is going to start and when you're seeing a DC right after the first adjustment. But you must understand that you may need a series of adjustments and other types of therapies that will help and address all of the different areas of damage that may have occurred. Whether understand it could be the malposition of the bones we talked about. It could be also damage of the bursa, of those sacs. It can be damage of the tendons, of the ligaments, of the nerves themselves. So it can become very, very complex. And you'd want to have that discussion with your doctor of chiropractic, and he or she can tell you what they want to do as far as your treatment plan. Because there is no one size fits all approach. You have to understand that the body is very complex. The way it's injured many times is complex in and of itself. So it's not a matter of just reducing or eliminating the pain. What you want to do is to repair the damage, because sometimes that reducing the pain is the easiest thing of all. It's been said that the pain is the first or the last thing, or I should say, it's the last thing to show up and it's the first thing to go. The last to show, the first to go. So you don't want to be misled into thinking that just because the pain is no longer there, the problem is gone. So that's something you want to do. And then also when you get the problem corrected, what you want to do is to rehabilitate that area. You want to build up those muscles, those damaged tissues. So again, you want to keep in mind that there's no one size fits all approach. Each person's unique anatomy, their build, the symptoms, the mechanism of the injury, the severity of the injury, how long the injury's been there, all of those factors are going to direct your doctor's choices of the methods he or she is going to determine for you when you're going to him or her. Some doctors are going to recommend nutrition. Some may use laser therapies. Some may use specific types of rehab exercises to be done. It may necessitate the adjusting of the segments of the spine, the bones of your back. and also adjusting the bones that make up that shoulder. I mean, it goes on and on and on. Again, those questions can only be answered as to what you need or what the individual needs specifically when he or she goes to the doctor. So it's really, really important that you realize that your body it's the only one that you're going to get on this side of glory, so to speak. So it behooves you to take really good care of it, okay? Really good care of it. And that really does mean that you'd want to seek out the expert advice of a doctor that's been trained in this kinds of things so that you don't, unfortunately, allow what you thought was a minor injury to get much, much worse, only to result in some kind of a permanent problem that you'll experience for the rest of your life because of you neglecting to seek out, a doctor to intervene there. Okay? And as I said earlier, prevention versus recovery. Prevention is always better than even the best recoveries. It's essential to keep in mind that prevention and recovery from the shoulder injury is going to require work on your part and specific work on your part, and which will include some of those exercises, those protocols that I mentioned a few moments ago. So those are discussions that you'll want to have with a doctor that is versed and trained in extremity injuries, with the arms, with the knees, with the wrists, with the legs, whatever it might be. Now we're talking about shoulder injuries, so doctors that know about the shoulder joint in and of themselves. Okay? All right. So look, I want to congratulate you for sticking this out. I mean, thank you so much again for taking the time to sit down and allow me to share this information with you, especially given the circumstance and in the times that we're living. If you do have any questions at all, please feel free to contact our office. You can call us at the number that's on our website. Our website is pro-activewellness.com, or you can email us at office@pro-activewellness.com. And we're here to serve you in any way that we possibly can. If you're watching this on our YouTube channel, of course, I invite you to join our YouTube station. And look forward to getting more information like this. And until the next video, and as always, I do want to thank you again for allowing me to share this with you. And until then, and as always, God bless.